What can cause HIE? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about some really important information. And this information deals with birth trauma cases and HIE. And the issue here is what can cause HIE. Now, HIE essentially means hypoxic ischemic encephalopathy. And I recently did a video that gets into way more depth about HIE. But for today's video, I want to talk about a cause. What can cause HIE? Now, there are a lot of ways in which HIE can be caused. And for the working definition for this video, we are talking about HIE in the context of a reduced level of blood and oxygen getting to the baby, which can lead to a brain injury. Now, there can be a lot of things that, like I said, that can cause this, but for today's video, I would like to talk to you about a condition called umbilical cord prolapse and why this can be very dangerous for your baby. Now, what umbilical cord prolapse is it is when the umbilical cord is delivered before the baby. Yep, that's right. The umbilical cord in some instances can be delivered before the baby. In a normal delivery, what we would normally see is the baby will come out, through a vaginal delivery, the head will come out, and then the umbilical cord will come out, down the line. But when we're talking about an umbilical cord prolapse, the umbilical cord comes out before the baby. Now, why can this be problematic in certain cases? Well, if the umbilical cord is compressed or restricted in any way, then we can have a reduced level of blood and oxygen getting to the baby. In some instances, and some people, they liken that umbilical cord to the baby's lifeline. And in a lot of instances, that is true because the umbilical cord is giving the baby blood and oxygen and other nutrients. So that umbilical cord is very important. And if it is restricted or if it's compressed, when we're dealing with that umbilical cord prolapse, then you can have HIE. That can come into play. Doctors and nurses, they might be able to tell this because, or they may be able to tell that your baby was no longer tolerating that vaginal delivery because the electronic fetal heart monitor, which is a very important tool, is used in hospitals all across, a lot of hospitals all across the United States when doctors and nurses are trying to determine a baby's well-being or how well a baby is tolerating a vaginal delivery. That electronic fetal heart monitor, when we're talking about a cord compression, what doctors and nurses can see is a sharp decline, or they can see a drop in the baby's heart rate. And if they're not paying attention or they're not helping the baby out through intrauterine resuscitation measures, or in other instances, when warranted, in emergency C-section, if they're not moving to this, when there is cord compression and there is an issue of possible HIE, if they're not moving towards some of these things, then the baby can suffer a brain injury. So why have I taken the time today to talk with you about this really important information? Because I'm giving you insight into this really important concept. Maybe you're watching this video right now because you have questions. Maybe you've seen this term HIE, or maybe your baby has been given a subsequent cerebral palsy diagnosis, or you remember during the delivery your baby was blue in color, or suffered from seizures, or had to be taken to the NICU. You remember these things, and now you are concerned about how is your child going to meet these challenges going into the future. If you have concerns like this is what I invite you to do. Go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. In addition to that, you can also reach me toll-free at 1-833-4BABY-HELP. If you're on my website, which is bostonlawllc.com, I would invite you before you leave to be sure to download that free download of our birth injury book that we have there. Go ahead and take a look at that, download that. It'll give you a lot more insight into this process here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here at Boston Law Group, LLC, in the state of Maryland, and we will see you next time. Take care and enjoy the rest of your day.